episode of Curbside with Dr. Jessica is brought to you by Sherman Abrams Laboratory, serving the clinical test needs for the greater New York area. Sherman Abrams is trusted and tested. So, hi, I'm Dr. Jessica, and here with me today is Dr. Amita Kalra, and we're going to just chat a little bit today about being a mom, being a woman in the workplace, what it was like getting the COVID vaccine, breastfeeding, and a little bit of things like that. So I'd like to introduce myself formally. I am Dr. Jessica Levatino. I'm a family medicine board certified doctor, and I was practicing in New York as the chief medical officer. And then I just recently moved to California to be with my husband with his job and bring our little one out here. And so far we're doing really well and pretty happy with that. And here is Dr. Amita. So if you want to just say a few things about yourself, and we'll just kind of get carried away.
Sure. Hi, thanks so much for having me on here. So my name is Dr. Amita Kalra. I am triple board certified in gastroenterology, obesity medicine, and internal medicine. And after finishing fellowship, I was working as a clinical assistant professor at Stanford University for 3 years. And then because of COVID, and I also had a baby right around the same time that Dr. Levatino did, my husband and baby and I settled in Southern California, and I'm now in private practice in Newport Beach. Things have been very different, obviously, which we'll get more into in a few minutes, but overall we're doing well and healthy, fortunately.
Wonderful. Well, I can't wait to finally meet her. I know we've only done videos for now, but soon. I just got my COVID vaccine not too long ago. I think you got yours.
Yeah.
Um, but let's talk a little bit about what this past year was like for you. I know for me, it was quite a whirlwind. I had just gotten promoted, and literally 3 weeks after, we had this whole pandemic hit, and it was just new information with new policies being made. It was interesting because it was trying to keep pace with what was coming out science-wise, but also doing what was best for the practice, what was best for me, being best as a mother. It was a hard hat to wear because it was many hats I had to wear at once. And it was interesting because it really trusted what I needed to do in the workplace and at home to keep my life safe and happy and carried through. What did you feel like it was for you during this past year?
Yeah, I think pretty much for everyone, I think it's safe to say there was a heightened level of anxiety, regardless of what side you were on, whether you were a doctor, whether you were just a regular person who maybe knew someone dealing with it, or whether you didn't believe in it or did believe in it. There was just a lot of anxiety, I think, around the whole thing. So I actually went on maternity leave about 2 weeks before the initial lockdown happened. So it literally like all happened while I was on maternity leave. And so a little bit of it almost was like a survivor's guilt. Like I felt bad that I couldn't be there with my colleagues and be doing what I've been so passionate about and trained to do all of these years. And I kept hearing stories about people and how hard they're having to work and how there's a shortage of doctors in the workplace, but really there was just nothing I could do. And it was a weird feeling. I felt in a way like relieved that at least I could keep my baby safe, because I knew that, being in the hospital while in my third trimester, the last few weeks of pregnancy, like it would have been obviously very potentially dangerous and really, really stressful. But it was a lot of mixed emotions there. And then, before COVID happened, my plan was to go back to Stanford, and I had the whole thing set up, and I was going to multitask it all out. And I had the nanny set up and everything was all ready to go. And then I just couldn't really justify doing that and feeling good about it. And so I had to make a really, really, really tough decision, because it was my dream job. And I had to make that choice to leave it. And it was a really, really hard decision. I felt like I was making a mistake, but then I also had to do what was right for my family. So similar to what you mentioned, it was like you had to juggle all of these different factors. But I think ultimately you make the best choice for what you and your family needs, and you just hope that it works out.
Yeah, I totally agree with you. I was a few weeks or months later than you, so I definitely worked through it. So it was a different feeling I had, because I had the guilt of I'm working, and I was getting a lot of just chatter from my family saying, "Are you sure? Are you okay?" There's a lot of studies coming out about pregnant women having high risk, exposure to these people, and getting sick yourself and being a patient yourself. And are you going to do okay? Because, I'm an older mom, a lot went into this pregnancy, and there was a lot of fear I had for something I had worked so long to get to and make it okay and things like that. Because in the very beginning, we were seeing, because I do urgent care, as I mentioned, we were really the front line before they got to the hospital. So they were coming in and we had to create policies for them to be safe to even come in, or are they doing drive through? Are we doing telemedicine? Are we doing a mixture of everything? And each location of our offices had something more they could offer. Some had parking spots, some didn't have parking spots, some didn't have as much waiting room as others. And it was just juggling what office could handle what and doing what was best for each center. So it was interesting because every answer was different, even though it was similar locations all around. I looked like NASA every day, basically. And it's funny because I would actually get made fun of a little bit for how I looked, but at the same time, I was just like, well, risk reward. I think it's okay that I'm wearing all this gear because I'm actually feel happy that I have the gear, because there's a lot of people out there who didn't have the gear. So I'd rather be wearing the gear and overprotected than unprotected, because not everybody was so fortunate to have PPE. As I think we saw over all the news, there was just a lot of things being said about access and having, not having, how much is being distributed to medical assistants, physicians, nurses, when they could get new pieces. So, I felt fortunate that I always had stuff to wear. Um, and then, after the pandemic hit, I had my baby and I was out for a little bit and then came back, and it was still kind of very busy. How has it been for you now that you've been back in the workplace?
Yeah, I mean, now things have like kind of settled down. I was initially doing just virtual actually because I was still working with Stanford when I came back from maternity leave. But because at that point it still wasn't really safe to fly, no one had their vaccine. I mean, it wasn't even like out yet. So I was doing virtual visits initially. And there was just a lot of, well, I see patients with GI issues. So irritable bowel syndrome and other functional GI disorders are really common. And obviously those get worsened during time of stress or depression or anxiety. And I was seeing just like an influx of patients who are coming back saying that they were completely doing well for years and years. And now all of a sudden, all of their symptoms have just kind of completely flared up. And so it was very apparent to me the kind of, whether people, again, whatever side of it you were on, there was just this like heightened level of anxiety and stress for everyone. And then as far as seeing actually COVID patients, I actually didn't see any COVID patients, but I did have kind of like family members and close friends who were seeing it and also dealing with it. And so it felt very real. But I kind of, I wasn't really in the hospital, so I didn't see patients with it directly as a physician, but I definitely felt it on a personal level, from just family and friends.
Definitely.
Yeah.
How'd you do with getting the COVID vaccine? I know I was truly excited to get it. I was patiently excited. I wanted them to have enough time to make whatever they needed to do, get the studies done so that I felt safe to get it. But I believe in science. And I think that was a testament to what a lot of doctors had to do, is just listening to the facts this year, because I think something interesting happened where politics came into play. Everybody kind of became their own version of a doctor. And it was hard to kind of disperse good information when there was a lot of good and bad information out there. But once you looked at the studies, they looked very promising. And I was very, very happy with what the results were. And I felt confident to get it. So probably about 3 weeks later, I was given access to getting the vaccine. So I got it and I breastfed through it, which I was really excited to do, because I was hoping anything would get to my baby, because I knew she wouldn't get a version of the vaccine for quite a long time, given the fact that we were still just getting adults ready for it.
Yeah, absolutely. I think when it came to just pregnancy and breastfeeding and the vaccine, there was a lot of controversy. And to be honest, like there weren't great studies done on it because it's hard to do those studies. Everything was happening so fast. So you really just had to extrapolate data that was available and kind of trust your judgment, talk to your doctor, take the best whatever risk that and reward, like you mentioned earlier, like whatever's worth it, right? And I totally agree with you. I trust in science, and I also was so excited to get the vaccine. Like the minute I could, I went and got it immediately. But I understand that there's a lot of misinformation out there. And I think it's really apparent on social media, which is the scary thing, is that anyone can post anything they want. And unless you really go through and check someone's credentials or their validity in terms of what they're saying and what their motives are behind what they're saying, then you can really get kind of swayed in the wrong direction. So I'm happy to know that a lot of patients and people and doctors are vaccinated, but it's still scary how many people, especially healthcare workers, are afraid to get it because, they're really at highest risk, as we know, right, from all the data that came out, just because of their exposure and all of that. So,
And the CDC just came out with something on Thursday saying about 77 million were vaccinated, and there's been about only 5,800 breakthrough infections, which is a rate of about 0.0075%, which is over 99.9%, which means, that's better than birth control and condoms when you think about it. To me, that's just awesome. And of that, an even less percent was hospitalized or had anything more severe, because really it was preventing severe infection. That's really what you want to do, is prevent death and prevent severe infection, which to me it succeeded in doing really well.
absolutely.
Yeah. What did you think about the pause on the J&J vaccine with the blood clots and things like that?
Yeah, I mean, it's scary, right? Because when you see the data, it's and you hear about it, it's making these headlines, but still overall the incidence of that was really, really low. And I think it's
Really well.
important to remember that. It's just that when it makes the headlines, it's super scary. And at the end of the day, rare things can happen, but you have to think about the overall good and how you'll feel. Like, getting COVID itself puts you at risk for blood clots and puts you at risk of, right? So that's essentially like where that's coming from. But, again, it's really just about understanding the data, understanding that there's robust evidence to suggest that getting the vaccine is overwhelmingly more safe than not safe. And ultimately, you have to make the right decision for you. But I know that I feel much more relieved knowing that myself and my family is vaccinated.
Me too. Me too. It's taken a while, but I think little by little we'll kind of be able to get back there, because I think we all just want to get back to our normal life a little bit. Just for mental health, for career sake, for just family life, for the growth of our children's brain and intellect and social nature and things like that.
Yeah.
I just can't wait to, I don't know, get a little bit of piece of normalcy back.
Absolutely. And to be able to travel again. I think that was, just a big part of what a lot of people were missing. We used to travel so much and it was like really a I know you did too. And it's like a big part of our lifestyle. And we wanted, but at least things are slowly starting to feel like they're getting more normal. Although now in India, I'm sure you've heard, it's just like gone so rampant and it's really, really scary. But hopefully, they'll kind of get things under control soon. But I think we were also surprised that they kind of missed that initial surge when it was happening, because it's there's such a dense population and such a small space. Yeah, so it was kind of amazing that they were able to keep it under control initially, but I think this is actually like getting really, really intense. So yeah.
I agree with you. It seems like each country has had its own wave, and each wave has had different peaks. Some have been similar to when ours were, some have been different. It's been interesting, the countries that have been late, because why were they late when their community was somewhat similar to ours? Could be different. Yeah, I really don't know. I wouldn't know what to say about that, but definitely interesting.
Yeah.
What would you say has been your best career advice throughout this whole, and what did it make you reflect on?
Yeah. Like during COVID, you mean specifically?
It
Yeah.
made us all reflect a little bit of what we wanted out of life. At least for me, it did, because we started thinking personally, professionally. I know I was reevaluating what my wants and needs were as a person, as a mom, as a wife, as a career woman. And it definitely made me pause and think, what would make me happy?
No, absolutely. And I think being a new mom also, right? That in and of
Mhm.
itself, like without this pandemic in the background, just being a new mom makes you question all of that because you have this little life that you want to be there to nurture. And all of a sudden, what you thought was important maybe doesn't seem as important anymore. That being said, again, like I had to make a big career decision just because of the fact that I was traveling every, 2 weeks to go to Stanford. And that was really the only reason I left. I felt like it was a really nurturing environment. I think it's important to find a place to work or a job or a position where you feel supported. And I felt extremely supported there. And I felt like I had a good work-life balance, which, is kind of like this catch-all term, but I think it's really important, especially when you're juggling so many different things. Because at the end of the day, you don't want to look back in 10 years and think, oh my God, I missed out on X, Y, and Z, and what was it really worth? So finding that job that's really fulfilling for you, finding the schedule that's right for you. I think a lot of us, especially women in medicine, because we kind of have to almost overdo or outdo what other people, maybe older or men, have to do just to prove ourselves, right? And like, I think that's where we put this kind of undue pressure on ourselves that we have to keep pushing and pushing and take the extra shifts and get a job where you're on call every other night or whatever it is. And I really made that active choice not to do that. And I'm so much happier with that. I make my own schedule, but I also very fortunate that I found this other female gastroenterologist to work with, Dr. Angie Sadeghi. She's just phenomenal and has been such an amazing support for me. So since I had to leave Stanford, I feel like I found kind of the next best possible thing for me. And my advice to young women, especially like if you're juggling other things, being a new mom, being a new wife, or being single, or whatever your situation is really advocate for yourself because it's easy to get lost in it. And it's really, really easy to get discouraged or fall, victim to these negative comments. I was told so many times along the way that I wouldn't be able to accomplish something, that I wouldn't be able to get a GI fellowship, or that I wouldn't be able to practice in California, or whatever the reason was. But you have to do what's best for you and leave the negative noise out and just kind of be your own cheerleader.
I completely agree. I think if there's anything that I wholeheartedly agree on is that confidence in what you want, because I think even with my residency and my jobs, I really put myself out there and I said, this is what I want. I'm a good fit. I'm, someone to be valued and work hard and, that always pays off. And I think I definitely wouldn't have had those doors open just voluntarily if I didn't kind of nudge them open a little bit with just being true to who you are and wanting that confidence of, I think this is a good place for me to head. I think a lot of women have to maybe be your own advocate a little bit. I think that's something that anybody has, male, female, whatever role you are. I think being true to what you need in life is key to success.
Absolutely. And finding a mentor or like someone who's willing to vouch for you, especially in medicine where there's so many different processes that you have to go through, right? There's applications, there's interviews, there's just so many different variables that can put you in a different state that you want to be for like 4 years at a time. So it's really important to find, work hard, prove yourself, and find someone also along the way who's willing to help you and be a true career mentor, like people who are on your team.
I completely agree. I think you should always surround yourself with something that you value or something that they have that you can learn from. I know with my friends in my personal life, my work life, there's something that I value about each of them. And I think that's important to keep people around you that lift you up, maybe push you a little bit, maybe make you a little bit more intellectual or make you think a little bit harder or have a little bit more gray to your thoughts instead of such black and white thinking. I think there's a lot to be seen and had done just by who you surround yourself with.
Absolutely.
How would you say that your role as a woman in medicine has been defined? Would you say it was easier, harder? I mean, I think I know the answer because I'm a woman myself, but it's nice hearing different points of view from other women in this role.
Yeah, definitely. I think, being in a male predominant field of gastroenterology, it was very obvious that I was kind of a minority, right? And it definitely was challenging at times, but again, kind of to piggyback off of what you said, it's just you push yourself and you put pressure on yourself because you always want to be the best and the greatest, and know that people can rely on you, and you be a trustworthy doctor and a trustworthy colleague. And a lot of times that means just really putting yourself out there, staying late, working harder, working, just more, basically, to kind of sometimes even do the same thing or to earn that same level of respect in the workplace. So I did have a very, very supportive fellowship with a lot of female mentors. So I felt fortunate that way. But just kind of overall in medicine, when you go to like these conferences and you're in a room full of like 10,000 people, you look around and the vast majority are men. So it's just an interesting dynamic. I will say that my patients definitely appreciate having a female gastroenterologist, and so I kind of use that as my motivation, my driving force to kind of stick with it and to get through it, because it was really challenging just in general as a fellowship. You're just working really, really hard, and sometimes I wondered, like, why am I putting myself through this? I could be working purely in an outpatient setting and not have to stress about things. And then I was just reminded almost daily that my presence there was also very valued. And I think that is what is a great motivator to keep you going in your career and in your job. And it's important to find that light, wherever you can find that, whether it's from your patients, from your colleagues, all of the above. But it's, if you have that desire to do something, and if you really want to prove yourself, you can, and it shows. And so I think it's been challenging, but it's been extremely rewarding.
Well, that makes me so happy to hear, because I do know that there's this whole wide range of happy and unhappy experiences within medicine, of just how hard you have to work for something to achieve that goal. Whether you're a medical assistant, physician's assistant, nurse practitioner, um, DO, MD, doesn't matter. I think there's all these different varieties of experiences that shape who we are. Some get luckier than others. It sounds like you had a lucky experience. I would say that I've had some great, some not so great, and I've definitely been able to value the great ones over the other ones because of what I saw in other experiences. And I think as you get older, you get more able to piece what you think is important and what is the best place for you as a person, because what works for one person doesn't always work for another, and what I find happy and what another person finds happy isn't always the same.
Absolutely. And I mean, I definitely had my fair share of struggles and challenges. I mean, I worked at an inner city hospital in Brooklyn, right? Multiple. And so there was definitely a dynamic, not just between colleagues, but between just staff. And being a young, enthusiastic, cheery woman isn't always the same vibe as what everyone else has. And that can, it was an interesting experience, but it taught me a lot. And I think what you said is just spot on, right? Like, not every experience is going to be a good one, but you take what you learn from all of those experiences, the good and the bad, to kind of figure out and shape what you want your future to look like. And I think that is what I actually value about all of those, trying experiences. I mean, even when we were in medical school, how many struggles did we face? How many difficulties did we face? But we wouldn't be where we are today if it wasn't for that kind of perseverance and that desire that, we know that at the end of the road, we're going to create the life that we want. And this is worth it to us.
Mm-hmm. And I think that's something I always appreciated about you, because we both had actually similar backgrounds. We both came from a small farm town, or I came from like a small place. You were 20, 30 minutes away from me. And then we went to college down south. And then we went to the Caribbean for med school, which was a wonderfully interesting year of growth and experience. And then to Miami, and then to New York, and then eventually back to California. All of these individuals with independence, and here we are, still similar with what our ideals are. And I think that's lovely about our friendship as colleagues, as personal friends, is that we've had a same and similar growth, which isn't always the case with everybody. Sometimes you find your paths are different, and that's okay. And then sometimes you keep meeting back at these forks in the road, and you're like, oh, we're still kind of similar. Oh, hey, we're still kind of similar. And here we are, hey, we're still kind of similar. And I think that has a lot to do with just knowing who you are and, seeing what values you want and where you want to go in life. And I think if there's anything that I've learned is just, find your passion, go for it, and keep true to who you are. And things usually kind of fall in place no matter what.
Exactly. And trust the process, right? Like there's going to be ups and downs along the road, but you end up where you're just supposed to be. And it's hard to see it sometimes in that moment. But I think just this past year has taught everyone that, right? Like you have to just slow down and let life just be a little bit. We can't control everything. And you just have to really just trust it.
Yeah, I totally agree. There was a lot of changes, not just in the medical world. I think people realized that we needed to get more virtual for certain aspects of it, even though medicine in general has been a very hands-on. I think we've always been taught, you know, you don't look at what the notes were before, you go examine the patient yourself, and then you see, if it's right, if it's not right, and you kind of take it from there. But I think this year we've created things a lot more virtually, which is new. I mean, it always existed, but I think we really built on that. I think wearable devices, video conferencing, all of these tech into medicine has really done wonders with where we're going as like the vision of medicine. I'm very excited to see where it's going to be in the next couple of years.
Absolutely. And also just the reach, right? Like you're able to reach so many more people this way. And it's also easier to kind of create that like work life balance, for yourself, especially as a new mom. And I think that's another similarity between the two of us is that we had our daughters like a couple months apart. And, we just kind of dealt with similar questions and similar career changes and decisions that we had to make. And you just kind of, I don't know, it was just a really big time for reflection, I think, like you said.
I completely agree. What do you think about all of these new wearable devices and virtual platforms? Do you think it's a good ad? I think it makes things a lot easier for medicine to go forward because there is a certain amount of things that don't need in office versus out of office. I think it's becoming a little bit more coming like staying with the times. What do
Yeah,
you
no, I agree with you. It is definitely staying with the times. There's like a joke that we say like a stethoscope around the neck is really just to like show that you're a doctor, right? Like you already have a chest x-ray probably on the patient if they're coming in. Like I think we've already been kind of one step forward, but now it's just making it easier to make that, I guess, not a bad thing, like what you said, right? It's like it's okay to look at the chart and review the patient's history and the labs and the previous notes, because actually with that and with speaking to a patient, you can pretty much figure out 99% of the time what's going on. Yes, if someone's having like significant symptoms, they need to be seen and evaluated and assessed. But for the most part, you can really do your job, I would even say better virtually, right? You have just more access to things. And with things being electronic and technology driven, you can also get information easier, so I think it's really headed in the right positive way. It's just a matter of, how do we set boundaries to that also? Because if everything becomes completely automated, then, where does that kind of physician's role actually get lost a little bit? And so I think we have to make sure that those boundaries are set. But I do agree for like, blood pressure, heart rate, oxygen, all of these things. I think it's actually great to have that data, and patients can also keep track of it themselves and be more involved with their own care, which is a big part of it too.
Yeah, I think that was an important point you said is just knowing what the boundaries of virtual and in office care. And I think that's just something that's always been important, but I think it's going to have to be re-emphasized probably a little bit over the course of these next couple of years as we get so virtual.
Yeah.
Just to make things safe for us, safe for the patient, safe for everyone all around, and you want the best outcome. You always want the best outcome, and there's only so much you can do in each setting.
Yeah, definitely.
Yeah. Okay. Thank you for joining me today with Curbside with Dr. Jessica and my guest, Dr. Amita Kalra, who is a very esteemed colleague that I'm happy to share this time with. Thank you for joining us.
Thank you so much for having me. I loved it.